several important differences with pediatric radiography. Most of these differences come in the context of room preparation, okay? With children, you want to make sure, with any age range, but with children specifically, you want to make sure you have as much ready and available as you can before you bring them into the room for the study. And the extra equipment is most often just these devices called positioning aids, okay? Positioning aids are things like sponges, tape, supports, sandbags, radiolucent supports, all these devices that are used to immobilize the body. Why would we need all these extra immobilization devices with children that we didn't need with adults? They're wiggly, right? Kids are wiggly. While they can often follow instructions, they have trouble staying as still as we'd like them to, okay? If someone doesn't keep still during a radiograph, what happens? Won't come out right? So what are we gonna see, RV? We're gonna see motion blur, right? Motion blur takes away from diagnostic information, and importantly, may require us to repeat the x-ray, right? Doubling whatever dose of radiation they received because you had to do it again, right? So motion blur is a problem that we try to avoid by using positioning aids. For infants, one of the main positioning aids is this device called a pigostat. A pigostat, and most of us have seen it before, but a pigostat is basically a infant immobilizer, okay? They sit inside of effectively a tube, okay, that you strap around them with their arms secured over their head, okay? When they're in that tube, for one, the tube is radiolucent. The cart itself will have a image receptor holder on it, okay? And importantly, they are not going to be able to move, okay? They can scream and cry and breathe, but they can't move. It's an immobilization device. The kid cannot consent to this because they can't, because they're not 18, okay? So who consents to it? Parents consent to it. What if the parent says absolutely not? Then there you go, you're not using it then, okay? What I often prefer is that the parent not be in the room, okay? Because I'm a parent. I wouldn't be, if I wasn't a radiographer, I wouldn't be super stoked if somebody stuffed my kid into that, right? But I'm a radiographer and I know why it's used, so I'm okay with it. But it looks a little barbaric almost, right? It looks medieval, right? But the point is, it's a device that's able to immobilize the infant, okay? And it's great, okay? It's great because it immobilizes them, and it's great because we can keep them upright. Now you can immobilize an infant on the table by swaddling them, okay? You can wrap their arms above their head, secure their arms, and swaddle them in a way that they will not move, okay? And you can use a radiographer or a parent to keep the child from wiggling like that, right? So you can immobilize the child. You can even strap the child to the table if you have to. That's even better. Yeah, I mean, you can't use that when they're asleep. But on the horizontal on the table, you can. The problem with them being on the table, supine on the table, especially for, most often is chest x-rays on infants. The problem with that is that you can't visualize air fluid levels when they're supine. So you have to have them upright to visualize air fluid levels. That's why this device works so well. There are other methods. You can have the parent, if they're old enough and able to stand, you can have the parent hold their arms above their head. But if they're if they're an infant though, none of that can happen. Okay, you have to put them in the pigostat, or you don't take infant chest x-rays, okay? But what I really like about it, aside from them being able to be upright and be immobilized, is, and it sounds mean, but they cry. It makes them really upset to be in there, okay? While that sounds bad, you're not happy that they're crying because you like crying babies. You're happy that they cry because when they cry, they take a big, huge breath in. They cry and they're letting all the air out, and then right after they let all the air, they go like that. Okay, and as soon as they breathe in deep, you take the x-ray, okay? So you have to sort of, as Parrish correctly said, you have to time it right, okay? timing is a huge part of performing pediatric x-rays, right? You're waiting for them to stop wiggling, you're waiting for them to cry and take that big breath in, right? And those are differences between children and adults. For an adult, you can just say, please keep still or please take a breath in. With an infant or a very young child, you have to time the x-ray correctly, which also means you have to consider your technical factors, right? As I mentioned for my new students, like a film camera where you decide how much light you let in and how long you let it in for, our x-ray machines were deciding how much x-rays we let out and how long we let them out for, right? Well, we have ways of shortening our exposure time so that we minimize the chance of motion during the x-ray happening, okay? We can shorten that exposure time up by changing what we call technical factors, keeping the same dose but making the exposure time extremely short. Those of you who have been with me long enough know there are advantages and disadvantages to shortening exposure times. The main advantage to shortening exposure time is minimizing the possibility for motion. The disadvantage is, from a technical standpoint, it decreases image quality. And we're not going to talk about why, but it does. Okay. Other things to think about, right? So technical preparation of the room is important. The technologist's attitude and approach to performing the radiograph, right? You're trying to talk in a way that is going to keep the child from being afraid of you, okay? They're already in an unfamiliar place. Often children do not like doctors' offices because they associate medical settings with shots, right? Pain, right? Not having a fun time. So you're showing them things. Make shadow puppets with them. Okay? Show them the X-ray light. Tell them it's a camera, special camera. Okay? Make shadow puppets. Play with them. You know, I keep a little stuffed bear, little stuffed X-ray bear in my room for kids to play with, and we let them be on the X-ray with the kids sometimes. We've even had the radiologist diagnose the X-ray bear before. We've sent the X-rays to we put the X-ray bear on the receptor with the kid, and the radiologist was nice enough to diagnose the X-ray bear as having no lung abnormalities. But importantly, you're taking just a more lighthearted approach to this, right? I know it's not fun for them. Try to make it fun for them, okay? As you see, she's making little shadow puppets on the light field for the kid, okay? So do something to distract the child from what's going on. That's huge, is distracting the kid from the unfun thing that's happening. Parental involvement, okay? If the child is old enough to come with me and take instruction, then I prefer that the parent stay in the exam room. If there are mom and dad, or if there is a male and female guardian available, I'm going to choose the male guardian if somebody has to come in with me. Why would we choose the male guardian over the female guardian? Well, no. So when I say me, I mean the X-ray tech, and I could be male, female, or whatever. Moms care more?
Like they're more like.
You're saying I don't care about my kid?
I'm saying more. They're like
I'm on board, and I completely understand what you're saying. Moms typically have built a different bond with the child, right? So it's a different bond, the moms and dads, right? But importantly, I'm not caring about any of that when I'm doing a radiograph. I'm worried about pregnancy, okay? And dads can't get pregnant, so I'm worried about that. What do you think, Francisco?
I was gonna say, as far as like children listening, dad can be a little bit more starter, basically. So some cases, but not all. It's like what dad says goes.
Sure.
So it's a lot more likely that
Sure.
the child would be a little bit more obedient.
You're right as a generality, but I've met a lot of dads who are really terrible at getting their kids to listen to them. But you're not wrong as a general idea, and so remember what we're referring to right now is sort of just the nuclear family idea, right? Of a mom and a dad and a child, but there are just infinite many options for how families are gonna work, right? So you want to, if the child is able to follow your instructions and is not completely petrified by coming with you, you want to have nobody else with you, right? It's not because you want to be alone in the room, it's because you want to avoid irradiating unnecessary people, okay? Keeping people that don't need to be in the room out of the room. I've done x-rays at a hospital. When I first trained as a limited tech, I trained at a hospital that was right next to a prison, okay? And so we got prisoners coming in all the time. Prisoners' guardians are correctional officers. Okay, I'll ask to take all the cuffs off the patient and kick the correctional officers out of the room. Okay, it's not because we want to be alone in the room, because I don't want to be alone in the room with a prisoner. Okay, it's because we don't want extra people getting irradiated in the room. Okay, so and the same thing goes with the parents, right? You want to you're in charge of X-rays, and you want to only X-ray people that need to be exposed. Okay, the most dangerous thing in the room during an X-ray exposure is the patient. Okay, and parents being right next to their children puts them at risk for scatter radiation exposure. Okay, so if they are an observer in the room, we're going to make sure that they are gowned appropriately, that they're shielded appropriately. Okay. So often, as you'll see, and it's sort of off, almost halfway off screen, but you'll see this is likely mom, because X-ray techs don't wear those big gloves. This is likely the mom wearing that big pink, the fluorescent pink shield. Okay, that we don't see here in this case if she has a thyroid shield on because her hair is in the way, but we know she's wearing the full fluoroscopy shield. Okay, this shields the chest. Importantly, in females, shields the breasts, right? Breasts are one of those issues with females and cancer. So it shields the breasts, it shields the ovaries in females, so we're shielding her gonads. And if a male were wearing that, they'd be shielding the breasts as well. Males get breast cancer too, and they're shielding their gonads, their testes, okay? And she's wearing gloves. She's having to hold her child's arm still, so we're providing her radio-opaque gloves. These are lead-lined gloves that you can't do much with, right? But you can hold a body part still. Okay. Other option would be, so observer in room, standing by. If they're an observer in the room and they're not actually helping with the exam, they're just there for emotional support for their child, we still shield them, but what we'll do is we'll keep them as far away from the X-ray beam as possible, okay? In general, if you can get a person to be at least 6 feet away from the X-ray beam and the patient, they have little to no risk of any scatter radiation. The scatter levels at 6 feet is almost negligible. Okay, so you can have them stand back but still wearing the shield. If they're a participant in the procedure, they need to wear the shield and they need to wear the gloves. Okay, so every X-ray room should have lead-lined gloves, and those are for the parent or guardian or whoever's holding somebody still to wear. The third and best option, when possible, is a non-participant. Okay, they are out of the room, kept in the exam room. You have to make sure that they're comfortable with that. So before you try to take anybody back to X-ray, sit down with them, tell them what's going to happen. We're going to take an X-ray of your daughter's forearm. It's two images, and ask if the parent's okay with you just walking her back to X-ray. Show the parent, hey, X-ray's just down the hall. It's right here. Will be about 5 minutes. Are you okay staying in the room? Okay, and if they say no, I'd like to come with you, then that's fine. If it's mom or female guardian, double check that they're not pregnant. Okay, so you treat them just like the patient. Is there any possibility you're pregnant or trying to get pregnant? If it's a no, then bring them with you. If it's a yes, I'm pregnant or I could be pregnant, then we're going to refer to the doctor. Okay, hey doctor, mom thinks she might be pregnant. Let's run a pregnancy test on her. Okay, or mom thinks she is definitely pregnant. Well, then let's keep her out of the room. Okay, so we'll refer to the doctor to make these decisions. Or if mom's like, I'm pregnant and I'm definitely coming with you. Okay, shield her. Okay, shield her and have her stand as far away from the beam as possible. Okay, those are going to be few and far between when that happens. And again, if you can, you want to take a male guardian with you, simply because males can't get pregnant. Okay. Patient motion. Okay, this is a larger child being used being placed in a picostat. The best way you will get good responses and good cooperation from patients of any age range is to have good communication. They need to know what you expect of them. Children are often willing to do what you say, as long as they know what to do, okay? Sometimes they won't. Sometimes they're hurt or scared and they won't, but children are often trying to do what the adults want from them, okay? You just have to tell them what you want, okay? So that's one thing, good communication. The next is immobilization, using different techniques to immobilize the body part. Sometimes that means placing a sandbag, just weighting down the body part so that it keeps their hand or arm or leg from moving. Sometimes that means placing the child in a picostat to keep the entire body still. But immobilization, sometimes it means taping them or swaddling them or otherwise supporting the body to remind them not to move. But immobilization is a technique to minimize the risk of motion during exposure. Short exposure times are your next best friend. Okay. Again, for those of you who are familiar with the terminology, high mass short time. High MA short exposure time. So keep the same mass, right? But high MA short exposure time. Okay. Keep the exposure times as low as you can. Raise the mass. Raise the MA. I keep saying that. Raise the mass. Raise the MA. There are other devices. This is a recumbent chest board, that uses straps to secure the child to it in the supine position. Okay. This can be done for the chest, abdomen, upper, and lower extremities. So you can secure the body part still on these boards and keep the kid from moving. Often there are you can actually, so these are often used, we keep these, like for example in my office, we'll keep these for if we have to place an IV on a child or do a surgical procedure on a child who they're not going to cooperate. We have boards that we can actually secure them to and hold their arms out, hold their legs out into a position and immobilize those body parts, okay? Again, making sure the parent is consenting to everything that you're doing as you're doing it. So don't just do it, tell them what you're going to do, and then with their consent do it, okay? But there are, again, different devices for performing these different procedures. We've already mentioned the pigostat, okay? The pigostat uses a series of clamps and seats and holders to hold the child in place and swivel it into position. I'll go get our pigostat in just a minute here to go over it a little more in depth with you. Sandbags are a great option, okay? Sandbags are not, they won't completely immobilize the body part. The kid will still be able to move it, but what it'll do is it's more of a reminder. Okay, if the kid's a little wiggly, the sandbag is more of a reminder to hold still. It's some weight down on the body part to keep it still. They're different sizes and shapes. They're pliable, bendy, and you can use them to secure and weight down any part of the body that you need to. Again, making sure the parent is consenting to it. Also take note that in this X-ray image, in this picture, you see the shield placed on the child's lower abdomen to shield the gonads during this forearm X-ray. Tape is another option. Tape is, again, more of a reminder. Okay? Do not use masking tape. It's not strong enough. And try to use hypoallergenic tapes. Tapes that do not include latex, because there are such things as latex allergies. So I've used tape plenty of times. Tape and sandbags are going to be some of your best friends. Almost every X-ray room carries sandbags, and definitely there's tape somewhere in your office. So you should keep tape in the X-ray room for these purposes. I use tape on adults too. We tape fingers out of the way, tape toes out of the way. It's really common. Looks silly, but it works great. Okay. Tongue depressors too. Just small piece of advice as I'm on the subject. Tongue depressors can be used to push a body part away from the rest of the body part so that they're not superimposing, like things like fingers and toes. So again, there's a lot of improvisation with what you're doing. Like there's not like a device that's used to hold the body still. There's just devices we have, and we use them in the way that we need to during that time. Other devices: compression bands and head clamps used on very young children, typically infants. Notice this infant has been swaddled. Okay, so they've had a literal swaddling cloth placed around them to secure their arms to their sides. And the head clamp has been used to keep the head from moving. Okay, it's soft. The part that touches the head is actually soft. Okay, and then you'll see that this wide strap here has been used, and this actually secures to the table and holds their legs still in this case.